Breast cancer can occur without any family history of cancer. Nearly 90 to 95% of breast cancer patients do not have a history of cancer in the family. It's only about 5 to 10% of breast cancer patients who have a strong family history. In these families, breast cancer along with ovarian cancers are very common and can occur at younger ages. You have people from multiple generations developing either breast cancer or ovarian cancer, including men developing breast cancers. The most common genes implicated for this are the BRCA1 and the BRCA2, and there are less implicated genes which are various. But in the BRCA1 and BRCA2 patients who have these mutated genes, they can transfer these genes to their progeny, and there's a 50% chance of inheriting an abnormal gene, and this increases their lifetime risk of developing both breast and ovarian cancers. For these patients, we screen them differently. We tell them to undergo regular clinical examinations along with mammograms and MRI breast at 6-monthly intervals, because they tend to develop the more aggressive variants of breast cancers like the triple negative variants. Also, the age at which these patients develop cancer are very, very young. We have women in their 20s, in their 30s who develop these kinds of breast cancer. When we talk about family history, we want to know only about your immediate family members, which include your parents, your siblings, your children, which is important, which is considered as important family history. Your distant relatives don't really give us much information about family history. So if you have a strong family history, today you can get yourself tested. It's a simple blood test which removes the DNA from your blood, and they can examine the genes, the various genes that are implicated for cancers, and tell you whether you have an abnormal gene. And if you have an abnormal gene, please talk to your doctor. They can tell you about various screening methods to help detect cancer earlier than usual, or you can also do something called as prophylaxis. There is chemoprophylaxis, medicines which are used to decrease your risk for cancer, certain kind of surgeries which can be done to reduce your risk for cancer. But please do remember that 90 to 95% of patients with breast cancer do not have a family history.